Good morning, everyone. Today is Thursday, December 20th. Thank you so much for joining into our weekly healthcare reform webinars. We have been running these since August of 2013, and this is our last series of weekly webinars. We are changing the format, and we'll talk a little bit about that as we have the last several weeks. But, for those of you that have joined in, I thank you so much for always being there, always asking those questions. So we do have a lot to talk about today. My name's Deb Wilkinson. I'm the Vice President of the Health Plan Options Department. And, again, these webinars have been run for a very long time, and questions are encouraged. So one of the ways in which you can ask questions is you can raise your electronic hand, which is in the control panel to the right of your screen, or you can type in your question in the question box, and I'll answer that at the end of the webinar. So let's get right into the agenda. As we all heard, Friday, the U.S. District Justice Judge Reed O'Connor ruled that the entire 2010 ACA law was unconstitutional. Obviously, appeals have been filed, in fact, by 20 states' attorneys general, and they want to overturn Judge O'Connor's decision. Until then, it is business as usual. Healthcare.gov took apps on Saturday, the last day of individual open enrollment. Virginia's Medicaid expansion, which is, part of the ACA law, that states could elect to expand Medicaid under those ACA law provisions. That's still going to take effect 1/1. Employers still need to provide coverage for dependent children to age 26. Medicare recipients will still get discounted prescription prices. Health insurance carriers' stocks did drop with the news, and this is just the tip of the iceberg. More information will follow, more appeals, more direction. At this point, they're trying to urge the district judge to put something out that basically says it's business as usual, that this has no effect. I think the biggest effect that this is going to have is typically these decisions don't, because it will go the whole way to the Supreme Court, and these decisions typically don't get made until the summer, June, July. So what that means for 2020 is, of course, 2019, the individual tax penalty is zeroed out, but carriers file their health plans for the following year in May. So May of 2019, carriers are going to be required to file rates and plans for products in which they don't know even if the ACA will exist for when the products are going to be sold. So it's going to be another year of instability, I fear, probably wacky prices to try to figure out what is going on. But as always, I'll be here and watching it and share that information with you. Our Pennsylvania Auditor General, Eugene DePasquale, issued a special report on December 11th calling for legislation that would enhance the pharmacy benefit management transparency, and the legislation desired would allow Pennsylvania to directly manage its prescription benefits instead of contracting with insurers. It will ensure price transparency for the PBMs, state oversight on the PBMs. It's saying it require a flat fee pricing model, so states pay PBMs only for services rendered. So I think, if this works well, it could really be, something good. We'll see. We'll see what happens. And again, as always, I will keep watching that and let you know. Walmart extends the contract with Express Scripts. It's a 3-year extension, and part of that deal is that they will participate with Inside RX, which is a savings program, and it's supposed to, obviously, the deal is supposed to save money for insureds and uninsureds, those that don't have insurance. So we'll see, again, how that works out, the best laid plans. The NEPA BOR news, we talked about this the last several weeks, but, for all of 2019, if you run across a group that is in Blue Cross of Northeastern PA territory, Highmark East, and they don't have a broker or they want you as the broker, go ahead and take those BORs. The non-brokered groups are now going to be commissionable, and they'll follow the BOR. If it's received before the 10th, then you will take over and receive commission the first of the month. after the 10th, and then if it's after the 11th, it's first of the following month after 30 days. Pardon me. So we've talked a lot about these commission retractions for capital for the under 65 and the med sups. We did get the audit list in over the weekend. Brandy and her team are working on it. But again, just review those statements. Reach out to Brandy and her team with any questions or anomalies. We want to make sure that you are paid accurately as we want to be paid accurately ourselves. So look at those retractions and let me know if anything, or let Brandy know if anything is out of whack. They are supposed to have been correcting anything that was issued from back to January of 2017. So again, it could be a lot of numbers and a lot of cases, but just please watch and look and check those statements out. Here's some news. Highmark commissions for the special election period, starting with effective dates of January 2nd through 6/1, they are going to pay commissions. So I did update our commission schedule. That's attached for you. And they are, again, going to pay through 6/1 effective dates. If you're in Central PA, it is an EPO on the marketplace, so the UPMC Pinnacles do not participate. So please be mindful of that. It's not going to be the perfect fit for everyone. And, you know, this is just for Central PA. I'm sorry, not just for Central PA. It's Central, NEPA, and West as well. But again, just be mindful of the networks no matter where you're selling. Aetna is going down to 2 lives for 1/1/19 effective dates. That's a pretty bold move on their part. But I think those plans have been trending well, and they certainly have been rating these groups very competitively. So if you have Aetna groups or any groups that are interested in Aetna's AFA plan, the level funded plan, then you can by all means start to get quotes if you haven't already. If there are 2 eligible, 2 must enroll. If there are 3 eligible, 3 must enroll. If there are 4 eligible, only 3 must enroll. But if you have a 2 and 3 person group, 100% participation is required. So we talked a little bit about this being the last weekly healthcare reform webinars. You know, we've run these, like I said, for many years and have had a lot of participation with them, a lot of great questions. Pardon me. Hopefully you felt that they were worth your time every week, but we're changing them. We're going to switch it up and hopefully make it in a format that might be a little bit more useful for you. Our Gemini partners will have a weekly sales and legislative webinar, and that's going to be held every Tuesday, and that starts January 8th at 9:30. And then our Aries, you know, our brokers, valued brokers, will have the healthcare reform webinars, and they're going to be held every second Thursday, and that is January 10th, that first Thursday. So you will need to re-register for the webinars for whatever webinar you are interested in. The Gemini partners will be getting an exclusive invitation. So again, watch for those invitations, sign up. In the meantime, if you have questions, please don't hesitate to call me. I'm happy to help you, whether you're a Gemini partner or an Aries partner or an Orion partner. So please reach out to me with any questions you have. So next Aries monthly webinar, as we mentioned, January 10th at 9:30, and then the weekly sales, that starts January 8th. Until then, we will not have a webinar. There will not be a webinar next week. So again, this is the last webinar. Wanted to also bring this to your attention. This is the screenshot from healthcare.gov. Court's decision does not affect 2019 enrollment or coverage. I thought that was pretty telling. One more note, we are still waiting for National General, the short-term limited duration programs, to be approved in Pennsylvania. As many of you know, they pulled all of the products, the 89 days, and every product that they have until approval from Pennsylvania is given. So hopefully that will be soon. Until then, IHC is the only short-term carrier that we are representing. So that is it. Happy holidays. Let's see what questions I have. If you have any hands that you want to raise to ask your question live, please let me know. And let's see. Nancy asks if the Gemini weekly webinars will cover the same information that will be offered monthly, or should Gemini also attend the monthly webinar? The Gemini webinars weekly, Nancy, are going to really focus not only on legislative updates, but also sales and some sales ideas. Some guest speakers will be coming in, whether it's from our life markets, annuity solutions, just any speaker that I think would be relevant to our Gemini partners in expanding not only their knowledge, but of course their opportunities to identify sales. The monthly webinars will kind of take the same format as our weekly webinars were doing, and that's really just updating on products and legislation. So I hope that answered your question. And that is it. Those are all the questions we have. As always, I truly thank everyone for joining in after all these years and weekly, asking your great questions. I hope that you do register for those webinars, whether it's Gemini or Aries. And until then, I wish you all a great balance of the week. I wish you a wonderful weekend and certainly a very, very Merry Christmas, Happy New Year, and Happy Holidays. Bye-bye.